What if help arrived not in weeks, but in seconds? Not just during office hours, but at 3 a.m. in your native dialect, without judgment or wait lists. In 2026, AI therapists are no longer experimental novelties. They're frontline allies in a global mental health crisis, offering scalable, stigma free, and surprisingly empathetic support. But their rise demands a deeper question. Can machines truly understand the human heart, or are they just mirroring it? The numbers tell a stark story. Over 970 million people worldwide live with a mental health condition, yet nearly two-thirds lack access to care, especially in rural, low-income, or conflict-affected regions. Enter AI-powered mental health tools. Apps like Wobot, WISA, and newer generation platforms using multimodal models to deliver cognitive behavioral therapy, DBT skills, and mindfulness coaching in real time. These aren't chatbots reciting scripts. Advanced LLMs fine-tuned on clinical transcripts, trained with input from licensed psychologists, now detect shifts in tone, linguistic markers of despair or dissociation, and respond with calibrated empathy, grounding techniques, or urgent escalation protocols. Crucially, the most effective AI therapists operate alongside humans, not as replacements. Hybrid models are emerging, and AI handles daily check-ins, mood tracking, and skill reinforcement, then flags high-risk patterns to a human clinician for timely intervention. In Rwanda, a pilot using a voice-first AI counselor in Kinyarwanda reduced depression symptoms by 42% in 6 weeks, bridging a gap where one psychiatrist serves over 1 million people. But the frontier isn't just accessibility, it's personalization. Unlike static therapy manuals, AI can adapt in real time, adjusting pacing for neurodivergent users, integrating cultural metaphors for grief or resilience, or switching modalities based on user engagement. A veteran with PTSD might receive exposure therapy simulations in VR, guided by an AI that monitors biometrics and pauses at the first sign of distress. A teen with social anxiety practices conversations with an AI narrator that provides non-judgmental feedback, building confidence before real-world interactions. Yet ethical risks loom large. Bias remains a critical concern. If training data underrepresents certain communities, the AI may misinterpret cultural expressions of distress or pathologize normal grief. Privacy is non-negotiable. Mental health data is among the most sensitive, requiring end-to-end encryption, on-device processing where possible, and strict opt-in consent architectures. And transparency is key. Users deserve to know when they're speaking to AI and what happens to their emotional disclosures. That's why the most trusted platforms now publish therapy model cards, detailing training sources, bias audits, clinical oversight, and clear boundaries, emphasizing that AI supports healing but doesn't diagnose or replace human connection. The future isn't cold automation, it's warm augmentation, using technology to extend compassion, not replace it. If you believe innovation in mental health should be ethical, inclusive, and human-centered, please subscribe to Tomorrow Intelligence, hit like, share this with someone who cares about well-being in the digital age, and tap the bell icon. We explore how AI can serve our deepest needs, not just our smartest ambitions.